We move on. It's been a big day for the NHS in the Midlands. Hospitals in Shropshire are being promised up to £300 million from the government to modernise and transform their buildings and services.
Well, also announced today the merger of two of the region's biggest health trusts. Heart of England NHS Foundation Trust will be effectively taken over by University Hospitals Birmingham NHS Foundation Trust. Heart of England had been run by UHB since October 2015, following a series of clinical and financial problems. But on Sunday, the two trusts will become one.
The newly combined trust will employ more than 20,000 staff. It'll be one of the largest trusts in England, treating over 2.2 million patients a year with more than 2,700 beds across its sites and an estimated annual turnover of £1.6 billion.
The Heart of England title will disappear, but its hospitals, Heartlands, Good Hope, Solihull and the Birmingham Chest Clinic will keep their names. The QE and other clinics across the city will stay under the UHB banner. So let's speak now to Dame Julie Moore, who is soon to be at the helm of the new Super Trust. Dame Julie, welcome to the programme. Tell us firstly what's going to change from the patient's point of view.
Well, initially we don't expect there to be much change. The hospitals are going to continue pretty much as they are at the moment. But over the next couple of years, as we really get the merger underway, we hope to provide a bigger range of services in more locations across the city. We think that every patient treated in our hospitals has the right to have the same quality and the same access to care. It shouldn't depend on which hospital you go to, how long you wait or the quality of care. We want to standardise that. Since we've been in Heart of England, there have been great improvements in quality, and the CQC showed that with their follow-up report done about a year after we've been in there, and we hope to continue improving that.
OK, just remind us of some of the problems that you faced in 2015. What were the major issues?
Well, one of the major issues has been a lack of investment, a lack of strategy for replacing equipment and replacing buildings. So we've now been developing a programme that will, over the next 10 to 15 years, completely replenish the buildings, but also the equipment at Heartlands. We've started doing that already, and we also need to do some upgrades at Good Hope and Solihull too. But some of the other problems really related back to there wasn't a proper governance system in, so performance wasn't being managed, clinical standards were not being maintained consistently. There were some pockets of fantastic practice, but equally, where there wasn't some good clinical care going on, it wasn't being addressed at board level, which it now is.
And we know that when it comes to the NHS, funding, as you've mentioned, and indeed staff shortages are perhaps two of the main issues that we tend to cover on our programme. I was just wondering, what are the main areas of improvement that you feel we need in the region now?
Well, that's another good reason for coming together, we can reduce duplication on a lot of central services that both trusts currently run that we could run as one. So, for example, if we all did our procurement, the stuff we buy for healthcare together, we think we can make major savings in the prostheses, in the drugs and all the equipment we use by combining our buying power together. Equally for recruitment, for some specialties it's been difficult to recruit when it's a very small specialty in one hospital, but by recruiting centrally and having staff rotate out to other centres, we've been able to get staff where previously they hadn't been able to do that, and so there's been a lack of service at some of the sites. It's proving to be a benefit for recruitment.
OK, we will leave it there. Dame Julie Moore, thank you very much for joining us.
On to other news, and the